My interest when I was in oncology fellowship was obviously in medical oncology, which is treating chemotherapy and systemic therapy. I was also very interested in sort of challenging cases of cancer. So there's a lot of work that's been done in the past 10 years or so in GI cancers, but there's also a lot of work that remains to be done. And for me, it's more interesting to sort of go into a disease where we don't know quite as much and we don't have all the right cures, but to be able to make that difference that gets us past the finish line and really into getting cures for cancer patients. I specialize in GI cancers. That includes cancers of the esophagus, the stomach, the pancreas, the liver, and colorectal cancers, as well as anal cancers. So it's sort of a wide variety of cancers that occur in the abdominal cavity. They're similar, but they're also different. So I don't make any decisions in isolation. We make these decisions as part of a team. And so the first thing you need to know is we work as part of a team. The team often is in the same clinic at the same time. So we've created these multidisciplinary clinics where the cancer surgeon's right next door, the radiation therapist or oncologist is right next door. I'm right there. We have social worker, we have geneticist. We have pretty much everybody that needs to see the patient at any point be in sort of the same geographic location at the same time. So ever since medical school, I've always wanted to do cancer medicine. And again, it goes back to challenges. So, in cardiology, cardiologists have sort of figured out how to treat heart attacks, and success rates are, close to 100%. Whereas in cancer medicine, unfortunately, there's still a lot of work to be done. And I wanted to be part of that sort of generation of physicians that develops the right treatments and that can make the treatment of cancer just as successful as the treatment of heart attack. I do love my job and I love taking care of cancer patients, but there's other things I love to do too. I like to read, so if you ever come to my house, you'll find 1,000 or so books before I switched over to the electronic book version. My son and I like to go hiking, and there's a lot of parks around here that we go hiking. And then when I find time, I also like to play tennis a little bit.